You want me to disconnect this fan and take it with me? Okay. Or no, leave them on. Just leave it, yeah. I know
It's moving day for the doctors and nurses at the Kapiolani Medical Center for Women and Children. The staff carefully executes the transition protocol to begin moving patients into the new 200,000 square foot Diamond Head Tower, a move that has been years in the making.
Today is the culmination of about 2 years worth of work, preparing and designing how we wanted our unit set up. But once they started putting the paint and the designs on the floors, it just, for me, it all came together like, wow, this is really real. I'm very excited. We've been talking about this for 16 years from when I first went into management, and it's a pleasure. I mean, this ranks up there with the rest of the NICUs that I've visited.
The numbers help illustrate the much-needed upgrade for the state's only full-service women's and children's hospital. The Neonatal Intensive Care Unit, or NICU, approximately cares for 1,000 of the most vulnerable infants with a daily average of 73 babies. The new facility now provides 74 beds and 70 private rooms, a 24-bed increase. The Pediatric Intensive Care Unit services nearly 500 children per year with a daily average of 11 patients. The new PICU wing features 14 private rooms with centralized monitoring. And the Medical Surgical Department, or MedSurg, is a new unit that has 12 private bedrooms and provides a variety of services for women in need.
It's, years in the making, but for us, we started in February, and it just started with meetings twice a month, 2-hour meetings. Anybody that was going to go to MedSurg, which you applied for the position, we would meet, and it was talking about what we wanted our rooms to have.
The symbolic paintings, large interactive lounges, along with other artistic and creative features, complement the state-of-the-art technology and spacious rooms that are now available to patients and their families.
It's amazing, just the rooms are so big, and if you'd gone to the other unit, you had semi-private rooms, which really can affect how you heal.
The ability to know where another nurse is based on our locating badge, the ability to call for assistance, you can now press a button and get the help that you need. So that's huge.
The transition to the new facility required nurses to embark on a year-long training program on the new technology and new services now offered at the hospital. From the PICU to the MedSurg department and to the NICU, the staff members of Kapiolani worked hard to learn the new standard practices to ensure a smooth and seamless transition.
There was so much preparation with the new phones. How do we communicate with each other? The alarm management. How do we deal with the individual rooms? So that's the biggest change for us than the current fishbowl that you saw us in. So we are looking forward to the nice calming effect of the individual rooms.
We had to go through chemo classes, because now half of our unit will be going up to the Women's Ambulatory Care Center, and now we'll be able to do 24-hour chemo infusions on the unit. So that's a big thing for us, because before they'd have to, only do it in the clinic. Now the patients can stay here and do 24-hour chemo. So a lot of the girls had to have training in that.
Just to see this is exciting. The different reinventions we've gone through, and how Kapiolani and now Hawaii Pacific Health has progressed and come together, and all our education and administration has afforded us this beautiful place now that I can now practice nursing.
As the hospital begins this exciting new chapter in its already rich history of servicing Hawaii's people, the compassion and commitment to patient care is one thing that has never changed and has resulted in Kapiolani Hospital becoming a symbol of hope and healing for women and children throughout the Pacific.
The Queen established the maternity home in 1890. She was very concerned about women's health and newborns, and we are able to carry on that legacy today because we have a state-of-the-art facility providing great care for the women and newborns and the children here in Hawaii.
I think for me though, more emotionally, it's the staff. How wonderful they are, truly, from the parking attendant on down, admissions, each doctor, each nurse has just been, I don't know too much about the equipment, to tell you the truth. I mean, everything looks brand new, but I think it's that caring, that compassionate feeling that is presented by the staff. It's just awesome.
We treat everyone like their family, and that's what I stress to the parents. You know, we're here to be part of your family and give you the support that you need during this really scary time for them.
At times it's very stressful and hard, but they feel like a family and they try to, you know, make things sometimes a little easier. And of course we try to, you know, get them very involved. For me, being here 35 years, they always keep in touch and they never forget you. And so I guess for me, seeing, you know, them as a whole as they grow up makes it very rewarding.